Hi, Carol Stanton here from Nature's Wisdom in Westerly, Rhode Island. Have you ever suffered from terrible anxiety, panic attacks? Have you ever felt like you're going to have a nervous breakdown? Do you have chronic insomnia where your brain runs all night? We call it busy brain. Well, did you know that having a vertebrae out in your neck can cause all of those symptoms? Today, we're going to talk about how the nervous system can affect so many different things and organs in our body. So I'm going to share a chart with you that is going to show you the vertebrae, and you can Google this for yourself. So here we see someone's spine. So in our neck, we have 7 vertebrae, cervical 1 or C1 through C7. So those have a profound impact on different functions of our body, and if they are out of alignment, it can really affect us in a negative way. Next, we have the thoracic vertebrae or the T vertebrae. So we can see T1 is generally right here where you feel that little lump in the back of your neck. That generally is where you'll find T1 or thoracic 1. So the T's go down the center of our back. So we have T1 through T12. After the T's, we have the lumbar vertebrae or the low back. So then we have L1 through L5, lumbar 5. After that, we have our sacrum and our coccyx. So let's talk about some of the symptoms we can have if our vertebrae are out of alignment. So for me, the most common vertebrae that is out of alignment is in my neck, and that is cervical vertebrae number 1 or C1. So when that happens to be out of alignment for me, the most common symptoms that I have are insomnia, that busy brain, my brain runs all night, nervousness. Occasionally, I'll feel like I'm going to have a nervous breakdown. Now, I never feel like that unless cervical 1 is out. So if I feel like that, I run to my chiropractor because I know what's happening. A lot of people are not aware of that these vertebrae being out of alignment can have such a profound effect on our brain and on our organs. So some of the other symptoms that you can have when cervical 1 is out of alignment are head colds, high blood pressure, headaches, and even headaches and high blood pressure together, just nervousness, anxiety, chronic tiredness. So that's for cervical 1. And then let's go on to cervical 2. When cervical 2 is out of alignment, some people will have sinus trouble, allergies, deafness, vision troubles, eye difficulties, earaches, and even fainting spells. So have you ever fainted and not known the reason why? It could simply be because the second cervical vertebrae is out of alignment or misaligned. Cervical 3, that affects our face and our facial nerves and our teeth. So when that's out of alignment, it can cause neuralgia or nerve pain, neuritis, inflammation of a nerve, acne, pimples, eczema. Cervical 4 affects our nose, our lips, our mouth, and our eustachian tube in our ear. We may have symptoms of hay fever, and we're wondering why, because it's not that season that we usually get it. Hearing loss, and it can affect our adenoids. Cervical 5, again in the neck, the fifth cervical vertebrae, that can affect our vocal cords, our neck glands, and our pharynx. Some of the symptoms we might see: laryngitis, hoarseness, sore throat. Cervical 6, again, another cervical vertebrae in our neck. That affects our neck muscles, our shoulders, and our tonsils. Recently, my 6th cervical vertebrae was out of alignment, and my neck was killing me, and my shoulder. And I'm like, wow, I slept wrong last night. I headed to the chiropractor, and sure enough, C6 was out. He put it in, and the pain slowly dissipated. Cervical 7, that's the last cervical vertebrae, the last vertebrae in our neck. And when that is out of alignment, we may have bursitis, we may have colds, and it can also affect our thyroid, our shoulder, and our elbows, the bursa in our shoulder and our elbows. Okay, so now we go into the thoracic vertebrae, T1, and remember I said that's usually where that lump is, right up here at the base of your neck. Thoracic 1, some of the symptoms that you may have is that if that is out of alignment, asthma, cough, difficulty breathing, shortness of breath, pain in your lower arms, and pain in your hands. All right, thoracic 2, that can affect our heart. Sometimes we might have a little bit of chest pain or chest tightness, certain chest conditions. Thoracic 3 or T3, that affects our lungs, our bronchial tubes, our pleura, and our chest. So some of the symptoms we might feel: bronchitis, we may be more susceptible to pleurisy, maybe more susceptible to pneumonia, congestion, and influenza. T4 or thoracic 4, that affects our gallbladder and our common bile duct. That can affect our gallbladder. In some people, if it's very serious, it can cause jaundice or even the shingles. T5 affects our liver and our solar plexus. Some of the symptoms that we might see when T5 is out of alignment: liver conditions, fevers, low blood pressure, anemia, poor circulation, and arthritis. Then we have thoracic 6, that affects our stomach. It can give us stomach troubles, a nervous stomach, dyspepsia, heartburn, indigestion, just not feeling good. T7 affects our pancreas and our duodenum. So that can cause ulcers and gastritis. T8 affects our spleen, which is part of our immune system. T9 affects our adrenal glands, can give us allergies and hives. Maybe we have hives for no explained reason. It simply could be that T9 is out of alignment. T10 affects our kidneys. We might have kidney troubles. We might have kidney pain. It can cause hardening of the arteries, chronic tiredness. Are we tired all the time? Could it simply be that that vertebrae is out of alignment? T11, thoracic 11, can cause acne, pimples, eczema, boils. So if you have acne and there's no unexplained reason, maybe you have a vertebrae out of alignment. I've seen it at my wellness center quite often. T12, the last thoracic vertebrae, affects our small intestines and our lymphatic circulation. So if we affect the lymphatic system, we're not going to be getting rid of toxins as we generally would or as well as we could. It can cause rheumatism or joint pain, gas pains. Then we have lumbar 1. That is the first lumbar vertebrae in our back, in our lower back. That affects our large intestine, and it can cause constipation, colitis, dysentery, diarrhea, ruptures, and actually hernias. Lumbar 2 affects our appendix, our abdomen, and our upper leg. It can cause cramps, difficulty breathing, acidosis, and varicose veins. Okay, so now we're on to lumbar 3, or the third lumbar vertebrae. That affects our sex organs, uterus, bladder, and knees. It can cause bladder troubles, bladder urgency, menstrual troubles, painful, irregular periods, miscarriages, bedwetting, impotency, change of life symptoms, and many knee pains. So sometimes someone may have a lot of pain in their knees. They may not be able to walk up the stairs. It could simply be that lumbar 3, or the third lumbar vertebrae, is out of alignment. Lumbar 4 affects our prostate, the muscles of our lower back, and our sciatic nerve. So have you ever had sciatic that starts in your butt and goes down your leg? Perhaps lumbar 4 is out of alignment. Difficult or painful or frequent urination, another symptom of lumbar 4 being out of alignment. Backaches, my back just hurts. It could be lumbar 4. Lumbar 5, the last lumbar vertebrae, that affects our lower legs, our ankles, and our feet. What are the symptoms when that's out of alignment? Poor circulation in the legs, swollen and weak ankles, weak arches, cold feet, weakness in the legs, and leg cramps. Then we have our sacrum, which can cause low back pain and spinal curvature. And the coccyx can affect our rectum and our anus and give us hemorrhoids, itching, and pain in the bottom of the spine when we're sitting. So if you don't see a chiropractor, it may be time to see one. Make sure you find one who has a lot of good reviews. Maybe you know people who goes to a chiropractor and they think that the chiropractor is wonderful. Get a lot of recommendations before heading to the chiropractor. Now, some people may not like chiropractic adjustment. Today, it can be much more gentler than in past. They have this little gun, it's called an activator, and it just clicks on the vertebrae and can put them in alignment. So you could call the chiropractor's office and ask if they have a activator, and ask them if that's what they used for adjustments rather than their hands. I know a lot of people are scared to have their head twisted, their body twisted. So the activator is a very gentle way to have or to get chiropractic adjustments. Have a great day. Look forward to seeing you again. Thank you for watching our Natural Health and Wellness channel. Please hit the subscribe button below to receive a weekly video on a variety of natural health and wellness topics. And please share our videos with others.